Okay, good morning, everyone. Um, I'm thankful for Jackie for having me do the training, and I hopefully today we'll learn a lot. We'll have an opportunity to have questions in between topics. Again, I'm Jerry McGee-Tyner. I've been here at the Consortium for 13 years, and I also have some history with the medical center. Well, it's Alameda Health Systems now, but it was the medical center when I worked there. I have like 13 years over there too. So I get around, or I've been around. So I will go ahead and get started. Well, from this slide, our consortium, for those of you who don't know, we represent 8 community health centers throughout Alameda County, and we also stretch into Contra Costa County, and just recently stretched into Santa Clara County. So as you can see here, you may be familiar with our community health centers and the great work and services that they offer. Okay, next slide. Okay, so was there a slide right before this? I'm sorry, what we were going to learn today? Yes, okay. I memorized my slides. No. So our learning objective today, we're going to talk about the eligibility requirements for MAGI and non-MAGI Medi-Cal. So you'll be able to understand what the difference is between the both. We'll identify benefits associated with Medi-Cal enrollment. We'll describe the scope of coverage based on citizenship, immigration status, and we'll establish client-patient expectations of the turnaround time, like when somebody applies. And we'll also talk about Calfresh in our county program called Health Pack. Next slide. So Medicaid is basically the federal program. That's what everybody in every state has federal funds for Medicaid, but in California, we call it Medi-Cal. So it is the Medi-Cal program. It is a joint federal and state program, and it helps pay for medical costs for people who have limited income, low income, little to no resources, and they have to meet the eligibility requirements. Next slide. So Medi-Cal, again, is our public health insurance program for low-income individuals. You will see families with children, seniors, persons with disability, our foster care children, pregnant women. They are all eligible, and there's more categories as well, but these are the predominant ones and categories that are eligible for Medi-Cal. And next slide. Okay, so MAGI. I know some of you looked at that and said, what is MAGI? Or we call it so many things, but MAGI is actually an acronym, and it stands for Modified Adjusted Gross Income. So when the Affordable Care Act passed back in 2014, we had a new eligibility guidelines for income, and it allowed more people to be eligible for Medi-Cal. So the MAGI Medi-Cal is based on your adjusted gross income for the household. So when you file your taxes, so that's how the eligibility is determined, based on your tax income calculations when you do your taxes. It has multiple coverage groups with income limits that vary based on age, or if you're pregnant, not pregnant. There is a premium if you are a child and you are above a certain federal poverty level of income. There's a small premium. Sometimes it's like $13 a month that you would pay. It's the former Healthy Families, for those of you, I'm probably dating myself, but Healthy Families used to be a program for children who were not eligible for full scope Medi-Cal. They had a little more income, and so they went on the Healthy Families program. Well, now it's the OTLICP. It's a children's health program. I don't know what the other, I don't know. We'll look at that in a minute. But anyway, it's the children's Medi-Cal who have extended incomes up to 266%. And we'll talk about that later. There are many exceptions to the IRS rules in certain tax households, but basically anybody who's claimed on that in the household when you file your taxes would receive eligibility for MAGI Medi-Cal. So if there's multiple people in the house and they don't belong in that family unit, or they're not claimable by the parents, then they can file separately. But if parents are still claiming children, then everybody has to be on the taxes, and that's what's determined for everybody, that income status from the taxes. Okay, next slide. Okay, so again, MAGI Medi-Cal. So again, when the Affordable Care Act passed, prior to the Affordable Care Act, you had to have linkage to be eligible for Medi-Cal and assets count. So they wanted to know how much money you had in your pocket, what your resources were. You had to be either pregnant or disabled. It was basically parents with children. And so a lot of individuals were not eligible if you didn't have children for Medi-Cal. So when Affordable Care Act passed, that ended that. Thank goodness. So more people became eligible for Medi-Cal. So MAGI Medi-Cal adults 19 to 64 with income up to 138% FPL could get full scope Medi-Cal. And we'll talk about what those benefits are. Uh-oh, my slide went away. Okay, so we'll talk about what those benefits are with the coverage. But anybody up 19 to 64 years of age, up to income level 138%, are eligible for full scope Medi-Cal benefits. And so you no longer have to, be linked to having children. And then the kids are eligible up to 18, and the income extends to 266% FPL. And just to give an example, if there's like say the parents, say it's a family of, I don't know, 4, and maybe the income is more than 138% FPL. So the parents would have to go into other options for coverage, which is Cover California. But the kids, say if the income is above 138 but below the 266, the kids can remain on Medi-Cal. So that's how you can have a household that has not dual, but 2 different coverages, okay, based on the income. Or again, if the income goes to 138%, then everybody has full scope Medi-Cal. So parents and caretaker relatives, the income for full scope Medi-Cal under MAGI is 109% FPL. Parents and caretaker relatives, those are like, maybe an auntie or grandma who's acquired their grandkids or nieces and nephews, and they could qualify as a caretaker relative, and they can get Medi-Cal benefits as well. Pregnant women, income up to 138 will get full scope. If they are above 138%, so the range 139% to 213%, they're eligible for pregnancy-related services only. So they won't get the full scope benefits, they'll get pregnancy-related services only. However, there is also a pregnancy program called MCAP, and we don't talk about MCAP, but there's another pregnancy program that extends the FPL, and it's not based on, like, immigration status isn't a eligibility criteria. So pregnant women could also be on the MCAP program. MAGI Medi-Cal also has an annual renewal. So they do have to complete an annual renewal to continue their benefits. Next slide. Oh, wait, before you go to the next slide, that's the nice, pretty new card. So I don't know if you guys remember it's blue. Yeah, it used to be blue and white. So they now made this nice, lovely state of California card with the California poppy on it. I don't know if a guy would be, how he would feel pulling out this card with all these flowers on it, but they are the California poppy. That's the flower. So you will see people now with this card. In the past, we would always say, do you have Medi-Cal? That would be your white and blue card. Well, it's no longer white and blue. You have to say, it's now the card with the California poppy on it. So that's why we put the image there, so that you guys know it has changed. Okay. Next slide. So MAGI Medi-Cal income, countable earned income. So wages, salaries, tips, commissions, profits from self-employment. So, you know, even with the self-employment income, there are different, you know, there are usually different attachments that go along when you're self-employed. However, it's still the bottom line of the adjusted gross income that is counted. So even people with self-employment income can, you know, apply for Medi-Cal. Next slide. So there's countable unearned income. And so the difference between earned is you're actually working, you going to work, clocking in and out. You know, you're actually receiving earned income for doing some type of service, a job. Unearned is you're not working at all. Can you move the slide up a little bit, please? So, oops. Oop. Okay, thank you. I can't see that bottom bullet, but anyway, unemployment, disability, retirement, let's see, pension, you know, that you get from your retirement, rental income, annuities, dividend payments. I can't see that bottom slide, the bottom bullet, but I think it says, I don't know. Well, anyway, can we move it up a little bit or no? Maybe not. I think it says tribal contributions.
Yeah, tribal gaming distribution.
Okay, because I can't see it on the, I don't know if that's my end or if anybody can see it, but okay, you can go to the next slide. Thank you. Those are just some examples of unearned. And just so you know, for the unearned, you would just show proof of that. So you would just have a, you know, proof of what your pension or what your Social Security income is, or, you know, or those other unemployment. You would just have to show proof of those documents. So excluded from income, child support. Child support is excluded. So they want you to pay that child support. So veterans benefits, education assistance, employment and training programs, federal tax refunds, thank goodness, bona fide loans, employment, oh, I said that one, sponsor income, foster care payments. I can't see the bottom bullet, I'm sorry. Let me see why I can't see it. So needs-based assistance from other, I can't read that last slide. My apologies. The last bullet.
Assistance from other agencies.
Agencies, okay. So basically, these are excluded from MAGI Medi-Cal, okay? And then remember, as I said, once MAGI Medi-Cal started, assets went away too. So you don't have to say how much money you have in the bank or under your mattress or wherever you keep your extra money, a savings account. It doesn't matter for your assets under MAGI Medi-Cal, which was a good thing. So it didn't matter, you know, extra money that you have in other areas. It's only based on income, okay? And so we went over the earned and unearned and what's excluded from the income. Okay, next slide. So this is we're gonna do like a little poll to see if you remember what MAGI stands for. So if you could take a moment to select the correct answer, and then we'll look and see if everybody got it right. So Yadi, I'll leave it up to you to close the poll.
Okay, I'm gonna close it now.
Okay.
I think everyone.
All right, so, okay, so most of you did get it right, modified adjusted gross income. So then there's a few of you who said manage, poll went away. Managed account gross income. No, that wasn't quite right. And then thank you for not saying make America give insurance. Nobody selected that one. So the correct answer is modified adjusted gross income. And again, if you can close it now, Yadia. Thank you. So again, if you guys file taxes, you know what that line is. I think it's line 7 now on the 1040, but it's the modified adjusted gross income. That's the answer for MAGI. Okay, so when you hear of that term MAGI Medi-Cal, it's based on modified adjusted gross income. Okay, next slide. Okay, so I'm going to take any questions at this point before we go on to the non-MAGI. So are there any questions?
Yeah, we have one question. It is, does educational assistance include grants and scholarships for room and board or just tuition?
I would think anything related to your educational assistance would not be counted. They're not going to make you count your grant or scholarship or anything related to education. So because that's designated for you to go to school. What is FPL? Federal poverty level. And oh, somebody answered that. Thank you. So basically I don't have a slide to show you, but based on every April, so you do know that this may change, they give a new income guideline, and it's called the Federal Poverty Level Guideline. And based on where your family size falls income-wise, there's different percentages where they will, the different cutoffs. So like I said, up to 138% is full scope Medi-Cal for MAGI. And then beyond that, it will have other, program options if you're the kids up to 266, but it determines what program you would be eligible for up to that certain income level. Okay, will you share this PowerPoint? I believe so. I think, is that all the questions?
I did have a question.
Okay.
Will you be going over like how to enroll in MAGI?
MAGI, yeah.
MAGI, sorry.
I don't know who came up with that. They could have just said modified adjusted gross income. But yeah, the MAGI.
The MAGI.
I will go over how to enroll, yes.
Okay, thank you.
Mm-hmm. Okay, is that all? Okay, we're going to move forward then. And again, if you have a question, you can continue to put it in the chat. So now we're going to do non-MAGI. So non-MAGI is basically the old rules for Medi-Cal. Okay, so normally these are the categories. So you have this one, the assets count. Okay, and we'll talk about that. So if you're non-MAGI, you are what they consider, okay, medically needy. So your age, they call it ABD. Sometimes you'll hear it referred to as ABD. So it's age 65 years or older, blind, or disabled. Those are the categories of medically needy. And then you also have medically indigent, which is a resident of a long-term care or skilled nursing facility. Okay, certain programs can require a share of costs. We'll talk about that in a little bit. But this is the non-MAGI. So you have the MAGI in the criteria and who's eligible and up to what percent. But if you are age, blind, or disabled, you are automatically non-MAGI. Okay, so the determination is different for non-MAGI and assets do count. Okay, next slide. So there's a non-MAGI Medi-Cal-Property limit. So in order to even be eligible to apply for Medi-Cal, you have to meet the property limit first. So as you can see here, a family budget unit of 1 is you can't have more than $2,000 in your property. That's the property limit. And so, and then for Medi-Cal family budget unit of 2 is $3,000, and each additional family member, you add an additional $150, right, to those numbers there. So personal property, cash, bank accounts, credit union accounts, trust accounts, stocks, bonds, fair market value of cars. So the first car is usually exempt, so you don't have to worry about the first car. The cash surrender value of a life insurance policy or a 401k, all of that is considered personal property. So they do look at these documents, or they will screen to say, do you have these items? You know, bank accounts, you have to give your statements, but you cannot have more than $2,000 for a family unit of one of these items, okay? You won't even be eligible to go to the next level to apply for Medi-Cal. This will rule you out before Medi-Cal. Okay, next slide. So this is how you guys may be familiar with the term share of costs. Sometimes you see it as SOC. So again, the way an example of the share of costs is determined in the following equation. It's the net non-exempt income. So basically, after whatever deductions they allow for, then you minus the state maintenance need. Now it's pretty low, it's ridiculous. In this example, for an example, family size one, so they get Social Security, so remember that's unearned income, $1,100. Well, the maintenance need for one person based on, this is what the federal government is saying, is $600. Now I don't know who living off of $600 a month, but they're saying, that's all you need. Unfortunately, it hasn't changed forever. So the maintenance need is 600. So they'll say, okay, minus the 600 from the 1100. That means a share of costs would be, I'm sorry, I just got a pop up in the chat. The share cost would be $500. And so let me explain what that means. It's not it's not a premium. So it's not like you have to pay $500 every month, like a premium. It's only in the month that you're receiving services. So when a beneficiary has a share of costs, they have this, they may have out-of-pocket expenses, right? But they have to pay up to the share of cost amount before Medi-Cal pays, basically. So the share of cost is to be met in the month for which services are provided. So if you don't have any services in that month, you don't have to pay any expenses towards your share of costs, okay? Now, do know that it's better for people in this situation to have all their services in 1 month. So like if they have to go to the dentist, if they have to go to the pharmacy, if they have to go to the doctor, because that can help spend down their out-of-pocket expenses and get the Medi-Cal on for that month. So after they meet the out-of-pocket expenses up to their share cost amount, then the share cost is met and they can get full scope Medi-Cal to pay the remaining costs, okay? This is an example of a long-term care. So long-term care, the maintenance need is a lot less, as you can see, $35. So it's because if you're in a long-term care facility, they're pretty much paying for everything that you need. So they're just deducting $35 from that. And so, excuse me, and so somebody's share of cost would be a lot higher in this example. $1,065 is what they would have to pay in the month that, similar to Medi-Cal won't pay until after they meet that share of costs. So, so yeah, you may see that. So this at the bottom, Hunt versus Kaiser, it was a lawsuit that allows applicants to use old unpaid medical bills to decrease the current or future share costs. So basically, when they're being screened and they have a share cost, they will ask the eligibility service technician will say, do you have any unpaid medical bills? And they will use that to decrease the amount of the share cost. So it's good, if somebody is in this situation and they have unpaid medical bills, this is a good situation that they should provide those so that they can get their share of costs decreased. Okay, next slide. Okay, so it's time for another poll. And then I'll answer some questions. So Medi-Cal has no co-pays or deductibles for its covered services, but may have a share of costs. True or false?
Can I give it about another 20 seconds or so?
Okay.
All right, I'm gonna close it now.
Okay.
Yes.
So what is our, okay, 90% said true and 10% said false. Okay, so the answer is true. They may have a share of costs. So again, it's not a copay, it's not a deductible, they may have a share of cost. And this is only for non-MAGI. You're not going to see somebody with MAGI Medi-Cal with a share of cost. If they don't meet the 138% FPL and they're over that, they go into Covered California. Okay, that's our state exchange with various health plan options, right? But for non-MAGI, they can remain on Medi-Cal with a share of costs. Okay, so so true was the answer. Okay, next slide. Let's see. Okay, so let me take some questions first before we go into the full scope Medi-Cal benefits. So I think somebody asked, let's see, if a person has life insurance policy for 10,000, they will be, so no, it's the cash surrender value. So some people have life insurance policies that have a cash surrender value. So there's different life insurance policies, right? There's some that, they don't pay out until the end of your life. But there are some where you can draw cash out of, right? It has a cash surrender value. So if you have one that has a cash surrender value, then that counts, that dollar amount. So, but if it's a termed life insurance policy, which is, some people have $100,000 termed life insurance policy. So it's like 10 years, 20 years, 30 years. But if you have one where you can get cash out of them, because some of them are like that, then that cash surrender value is countable towards your assets. Okay, what if the patient has a service month? Does the patient have to pay share of costs before Medicare? So in any month that they're receiving services, so they go to the doctor, say the doctor says your visit today is $100 and say your share cost is $200. Well, you're paying up to that $200 amount before Medi-Cal pays. So that's why I'm saying, say you go to the doctor and his or her charge is $100, and then you go to the pharmacy and your medications are, say, another $100. I don't know. Then technically you have met the $200 share cost, right? Then after that $200 amount, Medi-Cal will pay for the rest of that month, right? Any other services you have that month. So it's important at a fee-for-service location, they can spend down the share of costs. There's a way you do that in the state eligibility system where they can enter what the charges were, and it can help they can spend down the share of costs. Okay, there's a way to do that. So it's only in the month you receive services. Okay, I know it's confusing, but it's not a premium. Does the share cost start over for every new month someone gets? Yep. So say you go to the doctor in, September, let's say that, and you go to the pharmacy, you go to the dentist, so your share of cost is applicable, right? So say in October, you don't go to the doctor. Well, your share of cost is not applicable because you didn't even go to the doctor to receive services. So it's only in the month that you receive services. So yes, it does start over. Thank you for clarifying. Okay, you're welcome. Okay, let's move on to full scope Medi-Cal benefits. So as you can see here, it's a pretty extensive list of benefits: outpatient, ambulatory services, emergency, hospitalization, maternity, newborn care, mental health, substance abuse disorders, behavioral health treatment, prescriptions, dental, physical or occupational therapy, lab, preventative and wellness services, pediatric services, vision. So it's pretty extensive, but do know there was a time when our state cut back on certain benefits, that there was a time where vision wasn't covered, podiatry, some dental. So a lot of those benefits were restored, but do know sometimes when the state makes budget cuts, they cut out some of the benefits, unfortunately. But for the most part, this is what full scope Medi-Cal benefits will cover. And that's whether you have MAGI or non-MAGI. Okay, so next slide. So restricted Medi-Cal. So you may hear or see a printout that says, restricted Medi-Cal benefits. So normally it's related to pregnancy related only, or emergency related services, or long-term care services. So restricted means it's just for those services. Okay. So you still have to meet the income guideline, but maybe because there's an immigration status, or it's only going to cover you for those specific, you're not eligible for full scope, you're only eligible for limited, emergency only, or pregnancy only. Okay, next slide. So here's a scope of coverage. I think I just went over the scope of benefits. This kind of talks about the citizenship, which is useful. So U.S. citizen, satisfactory immigration status, crew call, DACA, which we'll go over later. And if you see here, the restricted or limited scope is like undocumented, or if verification is not provided for a U.S. citizen. So say you're a citizen, you were born here, but you don't have anything to show that you are a citizen. They will give you restricted benefits until you can show documentation. Now, they do make every effort to go into their own resources or system. They can verify, say, your birth certificate. They have systems that they can look to verify. So before they put you on that restricted, they do try to use resources that they may have access to. No share of cost Medi-Cal provides coverage at no cost. But again, for restricted, it would be emergency or pregnancy related only. This Medi-Cal with a premium, remember we talked about with the kids do have a premium when their income is up to that 266. It breaks it down so that the parent will know how much they have to pay out of pocket. But this is similar to the Old Healthy Families program. Okay, so that Medi-Cal with a premium is for the kids who are on the Children's Health Insurance Program. And that's what that premium is all about. They would pay I don't know, I say $13 because I just remember that number, but it's around something similar where they would have to pay that each month. And then you have the Medi-Cal with a share of costs. Again, a monthly dollar amount paid towards medical expenses before Medi-Cal will cover. Okay, and then restricted is the same thing. If they have a Medi-Cal share of costs, it would be the same thing. They would have to pay up to that dollar amount. Yeah. Okay, so next slide. So there are different immigration statuses. And so these are some that you guys may be familiar with. Medi-Cal considers these immigration statuses satisfactory immigration statuses. So lawful permanent residents. So those are referred to as LPRs. Okay. Refugees, Cuban, Haitian entrants, parolees, asylees, victim of trafficking. And based on the they have an immigration card that usually will have a letter that's associated with these satisfactory immigration statuses. Next slide. So PRU-Call, which you hear or may hear out in the community, it's PRU-Call, but this is actually an acronym that stands for Permanently Residing Under Color of Law. I don't know who came up with this, but that's what PRU-Call stands for. So basically, PRU-Call is it's not an immigration status. It's like it's a category. So there's different PRU-Call categories. Say somebody is here on, and they're claiming to have satisfactory status, like the INS does not intend to deport me. Homeland Security knows I'm here. Maybe they lost their documents. Maybe, they were stolen, or they just can't find their documents to show that they have an acceptable status to be here in the United States, right? So there is a form called the MC-13, and they would have to actually indicate on that form to claim PRU-Call status, okay? So that's basically what you need to know about PRU-Call. It does give full scope Medi-Cal benefits. So, they'll meet the income guideline, that we talked about, the FPL, and they would have to sign and claim PRU-Call, and they could get full scope Medi-Cal benefits under PRU-Call. Okay, so that's what PRU-Call is. Next slide. So we've had some great bills that passed. It's been a while now. Well, one of them was this year, but the SB 75, that was in 2016. And the Senate Bill S75, it gave all children under the age of 19, regardless of immigration status or verification of citizenship, they are eligible for full scope Medi-Cal coverage. Okay, so that means they still have to meet the, the guidelines, correct? But it doesn't matter their immigration status, whether they are, undocumented, not undocumented, this visa, that visa, this expired visa, blue, green, purple, it don't matter. If you are a kid living in California under the age of 19, you are eligible for full scope Medi-Cal coverage. Again, you'll be screened based on income, right? But the good news is that all our children should be covered, okay? For the most part, if they meet the income guidelines. So that was wonderful. SB 104 was even more wonderful. So that was Senate Bill 104, which gave young adults ages 19 to 25, regardless of immigration status or citizenship, they also are potentially eligible for full scope Medi-Cal coverage. And so there's a link there because that just happened January of this year. This is great, exciting. Confetti need to be falling right now because our young adults, they think they're uninvincible. And they show up in the emergency room because they were skydiving and ran into a mountain. No, just play. But they are eligible to receive benefits under Medi-Cal. So this is great. Now, the other great one that is still forthcoming, they want to allow, I forget which Senate bill it is, my apologies, but they want undocumented seniors to be eligible regardless of citizenship or immigration status for full scope Medi-Cal benefits as well. And so because the state had to make some budget cuts, that one is still forthcoming. So stay tuned because that would be great too. California is really paving the way of making sure that all Californians have access to health coverage. And so right now we just have the kids and the young adults, regardless of immigration status. They still have to meet the FPL cutoff, right? But if they do, then they're eligible. Okay, so next slide. I think we have a poll. Okay, all children are eligible for Medi-Cal benefits regardless of citizenship status, sorry.
So I'm going to give folks a couple more seconds. Ending it now. Let me share the results.
Okay, so 94% of you got it right. There were 6% of you. I guess I still need to twist your arm to believe me. So the answer is true. All children are eligible for Medi-Cal benefits regardless of their citizenship status. Okay, so please spread the word. It's true. Okay, it doesn't matter their citizenship. As long as they are a kid up under the age of 19, and then you got the 19 to 25. So really, but you can't call 19 to 25 kids. But in this scenario, all children under the age of 19 are eligible for Medi-Cal. Okay, so it's true. All right, next slide. Okay, so DACA. Just wanted to touch on this a little bit. So DACA, again, is another acronym. We have so many acronyms. Deferred Action for Childhood Arrivals. So you know individuals who fall under this DACA category are potentially eligible for full scope Medi-Cal, and that's under the PRU-Call provision. So if they're claiming a DACA status, they can apply for Medi-Cal. They still have to meet the income guidelines. But DACA individuals are not eligible in our Cover California exchange. So if they go over that 138 income, they're not eligible for Cover California, okay? Only for Medi-Cal, full scope. Next slide. So again, these are some of those other statuses that you may see for trafficking and crime victims. So non-citizen victims of human trafficking, domestic violence, other serious crimes, they may not have a satisfactory immigration status, but they can still qualify for full scope Medi-Cal under these special programs. Okay, so that's important to know. So trafficking and crime victims, the victims of trafficking, they usually have a T visa, okay? Or they're in the process of applying for one. Victims of domestic violence or serious crimes, they usually have they're granted a U visa for, it's a non-immigrant visa. So you may see these out in the community, or you need to know if somebody is a victim of crime or domestic violence or human trafficking. There are options for them to have coverage under Medi-Cal. Okay, next slide. So we also have a refugee program. So again, when the Affordable Care Act started, they are low-income adults, so they have to be under the 138% FPL. Without children or disability, they qualify for MAGI Medi-Cal. So here's a list of, different statuses: refugee, asylee, parolee. You may have heard of many of these, but it used to be 8 months only of eligibility for Medi-Cal, and now it's no longer 8 months. Okay, so you do need to know that it could be extended beyond the 8 months. If they don't qualify for MAGI due to income, there is a refugee Medi-Cal assistance program. You may see it with or without a share of costs, and it's still available for 8 months. And so that's just something for you guys to know in the community. If it's a refugee, to you can look into these programs to get them qualify for Medi-Cal. Next slide. Okay, so let me take some questions because I see some good questions. Let's see. For a patient that does not have restricted Medi-Cal benefits but wanted to be seen for a different, Oh, I'm sorry. For a patient that does have restricted Medi-Cal benefits but want to be seen for a different reason out of emergency, pregnancy, or long-term, should the patient enroll? Okay, so usually if you're getting restricted Medi-Cal benefits, it's because you're not eligible for full scope Medi-Cal, or you haven't provided the documentation needed to show your proof of citizenship to give you full scope Medi-Cal. So under restricted, if you're getting some type of service that's covered under full scope, you won't get it paid for because it's restricted to just pregnancy, emergency, or long-term care. So I don't know if that's clear, but it's usually for people, when you see that, it's because they're not eligible for full scope Medi-Cal, maybe because of their immigration status, they're here on a valid visa. It's different reasons where they may get the restricted. They're undocumented, but pregnant, you know. So I hope that answered the question. There is no documentation required for PRU-Call. So basically, again, PRU-Call is saying, I don't have anything to show you, but I can contest that I'm here. Homeland Security knows I'm here. I'm not on a, you know, gonna be deported. So correct, there is a box on that MC13. It's usually that last box if you're claiming PRU-Call status. So yes, that's true. You're not going to be showing any type of documentation, but you're basically, you know, contesting that I'm here and I'm here to stay. No, and so you could be screened for PRU-Call benefits, which gives full scope Medi-Cal. Okay, great. I made that clear. Okay, so now what's my time like, Yadiel?
We have until 11:30, so about 40 minutes.
Thank you. Okay, so I just wanted to kind of, somebody asked about how to apply. So applying for Medi-Cal, you can go to, it's www.my, we can send this all out in the follow-up, but mybenefitscalwin.org. So www.mybenefitscalwin.org. You can apply through coveredca.com. And so you can also call on the phone and speak with someone, apply through mail. You can fax over an application. They do have limited walk-in, so we don't want people to think that you can't go to social services. I mean, they're you know, due to the COVID-19 and the shelter in place, of course, they're encouraging more people to apply, you know, over the phone or through these other means because, you know, they want everybody to be, you know, they want to take into account people's health and safety during the COVID-19. So, but if you do go to social services, basically there's no lobby access. So you can't just sit in a lobby and wait. They'll come to the door, they'll see what you need, and you'll be assisted that way. You know, they'll take one-on-one, they'll do the screening, I'm sure, COVID-19 questions that they may ask, but they will still assist you, but there's no like lobby waiting in the lobby. They've closed the lobbies. So those are some ways that, you know, someone can still apply. Our health centers, we have enrollment staff who are assisting with applications over the phone. We have very limited drop-in, not drop-in, I don't want to say that, by appointment only. You know, they have very limited right now during the shelter in place, okay? But they are still assisting people with enrollment into Medi-Cal. And so somebody, I think, asked about transferring a case. There is a process when you go from one county to another. There is a transfer of Medi-Cal benefits process. And so you would have to contact the like Alameda County Social Services, and you can tell them my case is in Contra Costa County or LA County or San Mateo County, and they can do the transfer request. There's a process, but normally before you leave the county that you have residence at, they can start the process to let the new county know that we need to transfer this case to the new residency for Alameda County. or so forth. Okay, so let me take this question. Okay, so if you apply for Medi-Cal in covered California and are eligible for MAGI, will it automatically determine that you are MAGI and not full scope? Okay, so remember, MAGI is a category, modified adjusted gross income, that determines your eligibility for the MAGI criteria. So if you get MAGI Medi-Cal, you are getting full scope benefits. Okay, so maybe you want to clarify the question, but I don't know if you are MAGI and not full scope. Full scope is the type of benefits that you get under the MAGI or non-MAGI. How long does it take to transfer? I don't know. I've seen it up to, I've seen it up to a long time, but normally I think they want to give at least like 45 to 60 days. But it just really depends, you know. So unfortunately, there is no blanket answer to that question on how long it takes for the transfer. But they will get it in process. And there is a way to kind of, if there's some urgent need, to expedite it, okay? So you would, again, have to work with social services to let them know that you're transferring the case, and then they can go ahead and process that transfer. Remember, Medi-Cal also retros back 3 months. So if you had any type of services in 3 months prior to you getting approved for Medi-Cal, you would have to submit that form and information for those previous 3 months, and they can cover anything that any expenses that may incurred during those 3 months in that retro period. Okay, so do know that can happen as well. I had a case that took months. Yep, I'm sure you have. I've seen it where it took months. And some are quick. Yep, you're right, Elaine. So again, we kind of, work with them. Sometimes maybe they don't have all the information they need, or, different reasons. But again, you would just have to stay on top of them and normally they can be faster if there's an urgent need. Okay. So, can you say more about how SSA is doing phone appointments for Medi-Cal enrollment right now? Can people just call the automatic benefit info line and talk with someone, or do they? Okay, so it's not a phone appointment. So the phone number that they would call to speak to an eligibility worker to apply for Medi-Cal, I can give you the number right now. And then maybe Yadiel, can you type it in the chat or I could type it. Forgot I can do that. So the number is 510, oops. Let me type right. 510-263-2420 or 1-888-999-4772. Okay, so those are the two numbers. And so it's not by appointment. You can just call. Now, I'm sure they are busy, of course, because most people are calling for questions about their case or to get enrolled. And so I think the better times to call are during non-peak, which is usually early in the morning or in that late part of the afternoon. Okay, so again, you can go there. They have a drop box if you want to drop off the application or maybe some documents that you have for your case. They do have a drop off box at and one of the slides is going to show you the different addresses for the different locations. Somebody's giving some good advice. Call 5 minutes before 8:30, so you'll be in the queue. So that's good advice. So it will likely take a few months to transfer. It could be longer or shorter. I would just suggest you follow up with the new county or the old county to make sure they have it in process. Okay, so I really can't say the time frame for how long that transfer takes. I've seen it short, I've seen it long. Just, stay on top of them with that. The phone line, I believe that's a good question. I want to say it's 8 to 5 or 8:30 to 5. I'm sorry. So I'll put that in the in the follow-up. Okay, so but I think it's like 8:30 to 5, their hours. Okay. Based from experience. Yes, thank you, Adrian. Yadiel, thank you for that link. 8:30 to 5. Yes, I thought it was something like that, but call 5 minutes before 8:30. So now look at this. They do have automated phone service for case status, request verification letters, request forms or benefit amounts. So they have a 24 hours a day benefit information. So like if they're not answering the phone, they may have it where you can still get put in the, the data elements, your social security number or something, so you can get information back, okay, through the automated information line, okay? So that's good. And then they have the website there for, you can get this information via their website. Okay, next slide. These are the addresses of the county offices. And so if you can see here, now my apologies, I'm not sure if this one was updated for the Livermore. And I will make sure that you get the information because I'm not sure. I think they moved recently from that location. So I'll verify it. But here are the other offices that that you guys can, refer clients to drop off documentation or go to apply, but just remind them there is no waiting room situation. They will definitely have to be assisted one by one, and they're encouraging people to use the other, options due to the shelter in place. Okay, but they have drop boxes as well. Yep, I thought Livermore moved, so I will definitely get the updated slide. My apologies, I forgot that that this slide still had that old address. Okay, next slide. I love this interaction. Y'all helping me out? No. So let's talk about healthcare options. So in our county, we are a mandatory managed care county. So that means when you apply for Medi-Cal under the MAGI Medi-Cal, right, you have to sign up with one of these two health plans. It is either going to be Alameda Alliance, which is our local initiative health plan for Alameda County, or Anthem Blue Cross. Those are your only two options, and you have to do it. It's mandatory for MAGI Medi-Cal. So what happens is after you apply for Medi-Cal and you get the MAGI Medi-Cal determination eligibility, right, you have to complete a healthcare options form. And on this form, you're going to be selecting a PCP, which is a primary care provider, or a provider location, okay? On the form, you'll be able to see the different options there. Usually they'll mail you, I don't know, within 30 days, these health plan provider booklets, where you can select your PCP or provider location. There's a number affiliated with either or. And so there's also a directory that you can see here online, healthcare options, okay, this website here. Initial enrollment will usually be the first of the next month. And anything after, hold on, I gotta pop up. Anything after the 20th, it'll be eligibility be for the following month. So what happens is the eligibility will remain fee for service. So if you do go somewhere and get services, the provider would have to bill it fee for service as opposed to billing the managed care plan, okay? So this is the Medi-Cal Managed Care Healthcare Options phone number. So again, this is only for counties that have mandatory enrollment into into a managed care plan, all right? So this is the number that you would call for that, Next slide. So this is just some eligibility terminology because like I said, there's so many acronyms out there and references. And so this is just some guidance for you to help you understand what are you talking about. So here are all the different terms that you can just have for your reference. And again, the slides will be shared so you'll have it. Okay, next slide. So thank you, Eileen. I'm glad it's helpful. I know it is helpful because there's so many acronyms and we get to speaking in acronyms, and it's like, okay, what are you talking about? So health center enrollment staff. So I'm just speaking in behalf of our health center staff. We have, I don't know, we probably have at least 150 enrollment staff throughout our counties, in the counties that we extend into. And so even for you guys, it may not be health center enrollment staff only, but sometimes you're representing, maybe housing, behavioral health, or, different agencies in the community, but usually it's the community, the resources, like the places where you guys come from, you're seen as trusted resources, right? Where, you have information that can help support somebody getting enrolled in a benefit. Okay. And so, so I think the benefit of being that trusted resource, the patient's benefit or the client's benefit is that, we have outreach and education to help people become aware of their coverage options. We do trainings like these that you can come and participate in so you can be a little more knowledgeable, maybe not to, in the deep weeds of it all, but you can at least tell somebody, the information you learned today and how to get enrolled, how to keep their coverage benefits in terms of completing the renewal, help with, materials, but help break down barriers, have a level of expertise in eligibility enrollment and, offer fair and services in a fair and impartial manner, and provide referrals and resources. So I think, our roles in the community are very important, especially now during this time of COVID and the pandemic, so that we can really help people get access to healthcare. Okay, next slide. Okay, Calfresh. So before we go to Calfresh, let me just see, are there any questions? Is there a different number to call or for different county? I believe the number that was provided early is for, I think the health plans are for Alameda County, but the number should be the state number for healthcare options. And I think we put the link there. We can send you the link for healthcare options, but I believe that's for the state. And so, yes, for our county, Alameda County, those are only 2 health plans that you have a choice to enroll in. Curious to hear about how many anticipate any of these options may be changing as the state prepares to transition. I'm not sure about CalAIM. I'm not sure. What does OIMP or OM? You have to be more, did you see that on the slide? I don't know what that is, OIM. I don't know, Yadiel or Jackie, if you know what that is when looking for medical. I'm not sure what those terms are. See, I need an acronym list for those. So maybe if you could tell me what those mean. Okay. Okay, so let's go on really quick. Calfresh is another program. Our Supplemental Nutrition Assistance Program is called SNAP, formerly called food stamps. But we try to get away from that terminology because there is a stigma sometimes associated with being on food stamps. So we try to rebrand it as the Calfresh benefit. Okay, so again, there's an eligibility criteria. Calfresh eligibility is available to all citizens and most lawfully present immigrants. The maximum gross allowed is 200% FPL. Most Medi-Cal recipients are eligible, including students. So we try to get as many of our Medi-Cal recipients on Calfresh. There is no age limit, and expedited services are available within 3 days. And I know for our clinics, the average benefit is $150 a month, which I know some of our low-income families, especially now, could use. Okay, this is what the card looks like. It's like a big card or an EBT card. Well, it's called an EBT card, but it's like it's not like you pull out some stamps or something. It's very confidential. You just put your card into the card reader when you pay for your groceries or so forth. And the benefits would be on that card. Okay, next slide. Oh, pop up. Okay. While we're doing that poll, I'm just going to grab my charger for my laptop. It's dying.
So the question is Calfresh a nutritional program with no age limit? I'll give you guys a few seconds. I got about 42% of the vote in. Give it a few more seconds. And I'm gonna close.
Okay, so true, yes. Calfresh is a nutritional program with no age limit. That is true. 3% said false. There is no age limit. So as long as you meet the eligibility criteria, and they have different benefits actually for seniors, which we'll talk about in the slide. So thank you. We can go to the next slide. Okay, so Calfresh again is a nutritional program. It helps to improve health and well-being by assisting individuals and families to purchase nutritional food at grocery stores, local markets. I know right now during the COVID, you can actually get food delivery through Amazon or Walmart, okay? And there's a farmer's market match where they'll give you $10 of additional food dollars if you show them that you have Calfresh. So they'll take $10 off your benefits card, and then they'll give like a voucher for an additional $10. So that's the benefits of going to a farmer's market. Next slide. This is the income guidelines. So again, this changes every year. We have to make sure that what the new amounts are. So this gives you the gross based on household. You'll get the gross, the net, and the Calfresh allotment. So if you meet the gross monthly income, if you meet the net monthly income, which is after deductions, countable deductions, and you still don't go over that net amount, then your benefit will be the maximum. These show you the maximum benefits. Okay, and we've assisted some families that get like $600 a month, if they have that many children and they meet the criteria. So there's a good benefit to have if for a family. So this is the guidelines. Okay, next slide. These are ways which we talked about, same for Medi-Cal, that they can apply for Calfresh. So there's My Benefits CalWin or the getcalfresh.org. They have to give information about household members, income, expenses. There are deductions for like childcare, bills, utilities, rent. So they do, you are able to deduct these expenses. So these are some items that are suggested to bring when you're applying for Calfresh benefits. Next slide. So after you take submit an application for LPR cards is a legal permanent resident card. So I think it's referred to as a green card. That's what an LPR card is. An intake interview must be conducted. So after a client applies for Calfresh, they'll have to have an interview with the worker to confirm the household income, so forth. And then the determination will be made after that. Next slide. So seniors are special populations. So a senior is someone considered age 60 or older. There is no gross income test. So that chart that I showed you, you can eliminate that column that says gross income. They just have to meet the net income. They have different waivers for the seniors. So there's a face-to-face interview waiver. So they can do interview over the phone, and their recertification is every 24 months. That's 2 years. And effective last year, June 2019, there were about 19,000 SSI or SSP, which is Social Security, Supplemental Security Income. Those who are on SSI were not eligible for Calfresh in the past. So this was huge for not just the past, like forever. Like they never were eligible for Calfresh benefits. So they became eligible effective June 2019. So if you know somebody who's receiving SSI benefits, you need to get them enrolled in Calfresh. Next slide. So this is a scenario. I always like to do scenarios so that you can have an idea. So this is a family of 4, 1 child, 1 senior. Gross income, $3,600 in wages. And these are the potential deductions. That's why it's good to, make sure you understand the deductions or help them understand so they can show proof of these. So they'll get the 20% earned income deduction. They get a standard deduction. They get shelter, their rent receipt reduction, and then medical expenses for seniors. There's a list of, a huge list of medical expenses that they will deduct for a senior to get them on. And so with the net income after all of these deductions would be $2,025, and they would be Calfresh eligible. Next slide. This is a senior. Income $1,400. They can potentially get the standard deduction, a shelter reduction, medical expenses, and then utilities, PG&E, phone bill, and their net income would be below $990, and they would be Calfresh eligible. Next slide. Sorry. So this is something that we did, our clinics. We gave these prescription, it's like a Calfresh prescription referral. So if they're seeing a doctor and the doctor knows that they're a Medi-Cal patient or they may be eligible for Calfresh, it was a referral to someone who can assist them in our member services getting on Calfresh. And it just reminds them that they could get, an additional $10 match at a farmer's market, and they'll have extra food to buy groceries. Sometimes there are a lot of patients or community members who are suffering from chronic diseases, and they could benefit from fresh fruits and vegetables. They may be diabetic or hypertension, or they need to change their, eating lifestyle, right? So that if they're eligible for Calfresh, then they can get access to fresh fruits and vegetables. And so we promote this at our clinics, and this is a Calfresh prescription referral that we use. Next slide. So before I go into Health Pack, are there any questions about Calfresh? Thank you, Yadio, for the link. Eileen, great with the LPR. Okay, so Health Pack, let's talk about that. Health Pack is our county program. It is not health insurance. So it's not Medi-Cal, it's not Cover California. It's a coverage program that provides health care for our indigent population. So it's basically remaining uninsured persons who are not eligible for Medi-Cal, Cover California, or any public health program. They can be on our county Health Pack program. The Health Pack program is called Health Program. The PAC is Health Program for Alameda County. So that's what the PAC is for. That's just how many are approximately enrolled. And this website link will give you information about our county's Health Pack program. Okay, so Health Program of Alameda County is Health Pack, and the card is usually green, and that's like what it looks like in that bottom right-hand corner. Okay, next slide. Oh, I didn't go over this yet. Can you go back one? I'm sorry. So Health Pack, again, it provides services for our remaining uninsured, not linked to some other public health program. The only way to enroll in Health Pack is through One app, which is the enrollment eligibility system for Health Pack. The difference, Health Pack is like, it's funding that comes from state and federal dollars to counties to support, providing health coverage to those who may not be linked to public health programs. However, in our county, the benefits mimic full scope Medi-Cal benefits. So those services that were covered under Medi-Cal will be services covered under Health Pack. However, your limitations, there are certain providers of care that you have to go to that are contracted with Health Pack in our county. Our clinics are contracted. Highland is contracted. I think there are some other CBOs who are contracted. And then there was one more thing I was going to say. There is a renewal, an annual renewal, and the hospitals are limited too. So usually it's our county hospital. Okay. So next slide. So pop question, what does Health Pack cover? And this is a pop-up. Insurance that covers any low-income citizen. So these are the poll questions. A healthcare program that applies to all counties, comprehensive healthcare services through a contracted network of healthcare providers, insurance that covers any low-income citizen, including children of all ages. So what do you think?
We'll give folks a few more seconds.
Okay, I think that's good. So the answer, thank you, most of you got it correct. So it does, Health Pack applies to Alameda County. So Health Program of Alameda County is what it stands. Okay, I didn't see well, it doesn't matter. So yeah, so it applies to Alameda County. So remember, the kids are eligible for Medi-Cal, so they're linked to Medi-Cal, so they would not be eligible for Health Pack. Okay, and so more information would be on that link. You can close it now. On that link that was on the slide. Okay, next slide. We do a lot of outreach strategies within our health centers. So we do notices, flyers, robocalls to patients, text messaging. We have Medi-Cal member reports, and we use these as different outreach strategies on how to remind people that they may be eligible for Medi-Cal or Calfresh, or to remind them to complete their annual renewal and we can help you type thing. So we do a lot of outreach strategies using these different modes of communication to get out to our community and patient populations to help support enrollment and retention of benefits. Next slide. And these are some of those sample flyers. So it could be, these are renewal reminder notices that we send out to make sure that our patients know when it's time to renew their Medi-Cal, and if they need assistance, they can come in and get assistance. Right now it would be through appointment only, no drop-ins. Next slide. And at each of our clinics, these are some contact managers. I think Tri-City Health Center, they now changed their name to Bay Area Community Health, and they have a new manager, so we can update this. But these are our managers at our community health centers that can help, with questions about enrollment. Next slide. Our community health center network is our network that manages all of our managed care members. So this is just the contact if you want to verify somebody eligibility or a specialty network and so forth. And this is a contact for that. And I think it's over. Next slide. Oh, that's me, Consortium. So these are some of the trainings that we do. And, if you're interested in signing up for one of our trainings again, but I think this venue through the Care Connect is a good opportunity. So these are just other trainings that we do associated with Medi-Cal and Calfresh. Thank you. So my contact is here. So please feel free to email me if you have any questions. I believe we're going to do a FAQ also at the end, or send it out. This was recorded, so I think later, and maybe Jackie, you could speak about that, but I'm glad it was helpful. Thank you guys for all the great comments. And again, we're all in this together. I do want to add that during the COVID-19, there's also a presumptive eligibility. It's called COVID-19 presumptive eligibility. So someone who's not linked to Medi-Cal at this time, if they need to be tested or receive treatment, they can enroll in COVID-19 presumptive eligibility. And we will send that link out and information in the follow-up. So thank you all.